Okay, great. I think we figured it out mostly. It's okay. Do you need some help getting it up here? You got it? Okay. Well, welcome. I'm so excited to have you here. So we are going to be talking about restful nights and healthy bites. And I'm Dr. Casey Jones. And so we can probably stay sitting. You guys don't care, right? Um, Yeah, so I'm excited to be here. Feel free to ask questions as we go along. I'm going to run through some, there we go, some slides here. So who am I? You can go to the next one. Or do you want me to control this one for you? So I am a dentist. It's coming up on 14 years that I've been a dentist, and I am a mom of two cute kiddos who are just about to turn 11 and 13, Noah and Lily. And I'm a former professional dancer. I met my husband on a national tour of My Fair Lady. And so we performed on cruise ships together, got to travel the world. And then I decided that I wanted to go back to dental school. And in my journey with dental school, I've been interested in sleep apnea, sleep disorder breathing longer than I knew I wanted to be a dentist. I did research back in college on it. And so during the pandemic, I was reading The Oxygen Advantage by Patrick McEwen, and I came home and I was like, I want to teach the world to breathe. And that started me down this journey of all the things that you're going to hear about today. But I've trained with the Airway Health Solutions. I'm a diplomat with the American Academy of Dental Sleep Medicine. And so it's all connected and it's never one thing. We're going to talk about some of that stuff. So my first question is, what if? So what if I told you that catching and correcting a mouth breathing habit early on could actually help your children develop and prevent dental disease and possibly even avoid the need for braces? What if we realize that just because something's common doesn't mean that it's normal? What if kids grow into it rather growing out of it? And what if we could empower people to change something just by using something that they're using 20 to 22,000 times a day already? So we don't have to have all the answers. It's all connected. It's everyone always, never one thing. And we just want to try to open up the conversation because what if we could influence the change early on? So many of the adults that I see all ages, and a lot of the adults have here, everything's figure outable. Let me just turn you. So a lot of the adults that I'm seeing, I'm treating for sleep apnea, but they started as kiddos that were mouth breathing and they were having issues. So there we go. So those are my kids, a lot littler than they are now. They can't take the dentist completely out of me. So I was this new mom. These kiddos have teeth, and you should start brushing their teeth at age 1. And we'll go through this stuff pretty quickly because some people know these things, but I didn't. I wouldn't have if I was a dentist. One of my favorite things to be able to use is a little finger brush. So you get in there, you just use it, especially right after they have breastfed, for example. It just sort of gets them used to having something in their mouth, using a little washcloth. There's so many different ways you could use it. Stiffies are actually things that have xylitol in them. And so they're like little wipes that also have xylitol, which is a natural sugar that helps to fight the bacteria that causes cavities. Because kids aren't born with the type of bacteria that causes cavities, they get it from us, which is fascinating. So if we have more cavities, we're likely to pass that on to our kids. So by taking care of ourselves, we're actually taking care of our kids, which we know and people tell us, but it's so hard to put yourself first. You know, you have this little human being to take care of. The first dental visit by age 1 or 6 months after the tooth erupts, we're not looking for problems at that point. We're trying to catch things. And now I look at things differently. And so we're trying to catch things that are tongue tied. What sort of things can we help to do to redirect the bruise? How long do you need to help brush and why? This is probably a lot longer than most people would consider. So I usually recommend that we do it until they're 6 to 8 years old because when it takes their own shoes, because they get so independent right around that time that the teeth start to come in, and the adult teeth often come in behind all of the baby teeth, and they're so independent around age 6 that they often miss those. And I've had a broken heart where I've had to remove permanent adult teeth in a 6-year-old child because that's how decayed they were. The parent just didn't know they were there. And that I cried. So it's happened multiple times. So when should you start flossing? As soon as those teeth touch. That's usually around age 2. Only anywhere that you can't see in between the teeth, you can't get. It's kind of like if you're brushing the teeth, but you're not flossing where the teeth are touching. It's kind of like washing the hands without washing it between your fingers, because that bacteria gets stuck in there too, and it can cause holes in the teeth early on. So I should go back. I actually try to make it fun. So I call it hide and seek for sugar bugs. So anywhere that they feel a click, I have them lift their finger, and then that's where I found a sugar bug. So we're looking around for them, and they're like, oh, found one. And I think that kids do best with modeling. So giving them a turn, having them do it with you, watching them see what you're doing. This is my husband and my daughter. And trying to do that with flossing as well. But now I see things a little bit differently. So it used to always be about the teeth, about the oral health, overall health. But now I look back at the pictures of my kids and I'm like, oh, you can go the next one for me. I'm like, my child, check out that tongue sticking out. How adorable can he be? However, I see the open mouth. I see that tongue going forward. I see that open mouth. He was little. I see my daughter who would sleep whenever she was ready to sleep. If it was time for Lily to sleep, then she would sleep. But I see that she's got an open mouth. She, just like me, I sucked my finger. She sucked her thumb. I absolutely believe that thumb sucking, digit sucking is a mechanism to help with the airway because it brings the jaw forward. But as it's doing that and coping for an airway issue, it also is now forming the jaws because the muscle is gonna win every time. So mouth breathing and open mouth posture, like I said, muscle is going to win every time. So if a kiddo, nowadays, half the problem is that we've got these devices. All kids are on, and they're usually like this, or at least mine are. I'm not looking at it. And half the time their head is down too. And so that forward head posture, that open mouth posture, even if they're breathing through their nose, but that mouth is open, again, muscle is going to win every time, and the jaws are going to develop differently. So here's another great view of what happens. So if we are constantly having our head forward, a lot of times the chin will also come back with that. But if the chin is coming back, that's right where that airway is. So if we're not getting that forward, down and forward growth of the jaw that we want, then our airway is back here. So the further back that chin is, the more likely it is to close off the airway. And the same thing if you open your mouth, your airway is down here. So as we open, we sort of close that off. We also get to see like the allergy shiners. So that's not from kids being tired. It's usually that they're underdeveloped in their jaws here. And so you see the venous pooling in the area. So this is a slide that shows that having the jaw further back makes a more narrow airway, because here's the airway. There's way back here, here's the nose. So the roof of the mouth is the floor of the nose. So if the tongue is not up to the roof of the mouth and helping to develop that jaw, we get more narrow jaws, which literally means we have a more narrow nose because it goes so far back, which means that then they're breathing through their mouth, which then means that the mouth is open, which then means that that jaw is back, which then means that this is smaller. So all of a sudden you have this kiddo that instead of breathing through a garden hose, they're breathing more like through a straw, or even worse, a coffee stirrer. And then if you throw in breathing through their mouth and the tonsils getting bigger because they're trying to filter this filthy air that we have, and it's the only way that it can do it if it's not breathing through the nose, then now you have a coffee stirrer with a couple boulders thrown into there. And how can these kiddos breathe? So with sleep disordered breathing, it's a bit of a range. It starts with noisy breathing, which is most common in kiddos. You kind of hear like the, but then it can go up to snoring, upper airway resistance, and obstructive sleep apnea. So thankfully, most kids don't actually have obstructive sleep apnea, but they definitely start off with this sleep disordered breathing and this pattern that continues on. And so many of the adults that I have say, oh my gosh, that makes so much sense. I was never a good sleeper. Or, oh my gosh, I had my tonsils removed. Oh, all of the things. Oh, I had crowded teeth. All the signs that there was an issue going on all along, that had we been able to catch that, maybe things could have changed. So the good news is that only 5% of children have obstructive sleep apnea, but an estimated 30 to 35% have sleep disordered breathing, which can include mouth breathing, upper airway resistance, obstructive sleep apnea. I had allergies and asthma as a kid, so chronic stuff that makes you breathe through your mouth instead of your nose can cause an issue. And sometimes just not breathing through the nose can actually cause nasal disuse. So if you're not using it, it becomes stuffy and you can't use it. You just want to participate. I love it. So dysfunctional breathing and sleep disordered breathing in children, some signs and symptoms, there's a lot. So it could be mouth breathing or snoring, especially when you see kids and their head is kind of like back on their pillow because they're lifting up their chin, almost like doing CPR to be able to breathe, and it brings the jaw forward. So that open mouth posture. We see teeth grinding. So I used to say, they'll grow out of it. They're growing, so their teeth don't fit. But now we know that a lot of times they're actually trying to do that CPR while they're sleeping and the teeth get in the way. And so we see ground down teeth even in kiddos. We see crowded teeth because their jaws aren't developing. And there's a lot of things that are causing that. Our softer diet is also causing that. But we see more oral disease. So I see a ton more cavities and more gingivitis in kiddos who are mouth breathing and have sleep disordered breathing than those who are not. We see the big adenoids and tonsils. We see chronic allergies, asthma, eczema, ADD and ADHD. It's fascinating to me that in Australia, it's actually illegal to prescribe a medication for ADD or ADHD in a child without doing a sleep study first, because the signs and symptoms are almost identical. So many kids, or at least the adults that I see, are like, oh, yeah. So I had ADD as a child. I was diagnosed this thing that made it even harder for me to sleep. And now it's all making sense as they're finally getting treated for their obstructive sleep apnea. We can see behavior issues because an exhausted kid is going to look different than their grown counterpart. So we're just like, oh, but they're bouncing off the walls and they're just like hard to manage because they're moving to try to stay awake. And honestly, they might be grumpy because they're tired too. So there's depression, anxiety, peer problems, bedwetting, because a lot of times they're not getting into that rest and digest mode. They're not switching things off. And so we see longer bedwetting and difficulty in school. So they're not getting the oxygen they need necessarily while they're sleeping. And that affects the development of the brain. Delayed or stunted growth, tossing and turning. So all those tangled sheets can be a sign. Nightmares, night terrors, morning headaches, especially acid reflux, especially in adults, but certainly in kids, also can be a sign. Picky eating or messy eating, sometimes that tongue, maybe there's a tongue tie, maybe that's contributing to why they can't sleep well. So what am I looking for when I see anybody, kid, adult? So usually what I have them do is just open up their mouth, and I'm looking in there to see, okay, well, what does their airway look like? Because if they open their mouth and you can see that air hole, that's awesome. I don't see that in very many people. Usually what I see is this number 4 over here, where I can't see anything between the tongue and the roof of the mouth when they're awake. And oftentimes when they fall asleep, that collapses even more. And so as a society in general, we're just built in the way that we're higher risk for sleep disorder breathing because we have a small air hole to begin with. Add on top of that, this is more common in kiddos, but sometimes they'll open and I'll have them say, ah, and I look at those tonsils and they can be kissing tonsils. So if you look at this kiddo that came to me, he was struggling. So here, this is when he says, ah, but here's his uvula, that little punching bag. These are his tonsils. And so most of the time when they say, ah, those tonsils will actually move a little bit, but they're probably actually kissing. And even if they're not, they're touching that uvula. So he was really struggling to breathe. And he did end up having his tonsils removed because at that point, you kind of just sometimes have to get that stuff out of there so this kid can breathe and then retrain the breathing and redirect things from there, because it's important that they're getting their sleep and that they're getting the oxygen they need. But this. So this cute little baby smile where all the teeth are all close together and it's like perfect. It's so cute. And I go, oh, those jaws are small because that then often turns into this crowded smile over there on the other side. Sometimes we see where you can see that bottom one. You may not be able to tell, but this means they've got a really narrow jaw. So they actually have what we call a crossbite in the back. They have this big overjet. So most likely that tongue is going forward every single time that they swallow. That jaw is certainly set back. And so it's kind of like this. I don't know if anybody's ever been told about this FedEx symbol, but it was really recent that I learned that there's actually an arrow, a sideways arrow in this logo. And now that I know that, I can't unsee it, but it's right here. You see it? I had no idea. And I've seen FedEx symbol or logo for how long? And now every time I see it, I go, oh yeah, a sideways arrow. So once you see it, you can't unsee it. And I was seeing it in all of my patients. So what options do we have to treat sleep disordered breathing in children? You certainly can do a tonsil and an adenoid removal. However, sometimes the tonsils can grow back, and if the habit isn't corrected, tons of studies have shown, and you may be able to speak to this better than I can, that it's not long-term results. So they may do better initially, but then the problems come right back because the habits never change. It's not magic that they then know how to do this stuff. Myofunctional appliances. So I'm trained both in Healthy Start and MyoBrace. I personally prefer MyoBrace, but they're both good systems. Palatal expansion. So sometimes we can actually help grow the airways, top and bottom. Early expansive orthodontics, or maybe you've heard the term orthotropics, which is essentially now trying to even grow and capture the epigenetics that we're not getting from all the softer diet and everything these days. Allergy treatment. So if a child is allergic, if they're allergic to dust, dairy, dander, if they have an entire bed full of stuffed animals, get them off. If they can't breathe because of that sort of thing, or if they have carpet on the ground or whatever's going on, if there are ways that you can minimize that, that can be helpful. Tongue tie release. So with tongue tie release, sometimes I'm really finding that it's habit, that it's the open mouth posture and just the lack of knowing how to do things that is affecting a lot of these children. And so the first step is myofunctional therapy. And that's even in adults. The first step is figuring out how well can we get that tongue moving? How can we get that person functioning within the capacity of what they have? Because why not do what would that be called instead of physical therapy, like pre-therapy? Yeah, prehab. That's what I was looking for. Thank you. Prehab instead of rehab. So see how healthy you can get them before you do surgery. Myofunctional therapy. So that's kind of like physical therapy for the tongue and the airway. And I try to keep that really fun for kids, and we can go over a few things. Breath retraining, I feel like you can't separate that. So first I started with the breath retraining, and then I found, I'm talking about the tongue all the time, and I'm giving these exercises. So now I got to train in myofunctional therapy. You just can't separate them, in my opinion. We try not to use positive airway pressure therapy on kids because that mask is going to restrict their growth and keep them from growing forward with their jaws even more. So the best gift that I can give to people is for them to have the ability to empower themselves. So to me, helping to establish nasal functional breathing patterns can help with so many pieces. And I kind of think of it like physical therapy for the tongue and the airway. So what can you do? So depending on the age of your kiddo, there are things called steps. So one of the breath retraining things that we can do is learning to do breath holds. And in kids, they often like to do like games more than exercises. And so the whole point is to see how many steps just walking that they can take or how many paces they can do and build that up. And so for an adult, the way that I would teach it, it's similar to the nose clearing exercise. So you take a normal breath in and a normal breath out. You can pinch your nose and gently nod your head up and down as many times as you can until you feel like you have to take a breath. And then you let go and you breathe through your nose. And oftentimes, if you check before and after, your nose might feel clearer. For a kid, this is really just a distractor. So most of the time, I'll just have them walk the halls with me. And so we take a normal breath in, normal breath out, pinch our nose. I count how many steps they're taking. We might march, we might skip, whatever I can do to distract that kid. Because if the kid is 5 to 7 years old, we're trying to do 50 to 60 paces, 8 to 9, 60 to 70, 10 plus is 80. And one of the things you can do to test and see if they can breathe through their nose is just take a sip of water. And if they hold the water in their mouth, because kids like to get it right. And so I will see them skip, like get little sips through their mouth and stuff. So if they have water in their mouth, it helps them to keep their mouth closed. They hold it in there and they breathe through their nose. And if you can breathe through your nose for a minute, you can breathe through your nose for life. So belly breathing is another thing. So for kids, you can toss me that bag. There are some things that I like to use, but one of them is literally toys. And so performance here. My website, on my website, I have some links to stuff I love, but this is one thing that's kind of fun. It's a toy, but they can use it not only as a visual, so when they inhale, you can open it, and when you exhale, you can close it. But they can also lay on their back, put a stuffed animal on their belly, and then see if they can make that stuffed animal go for a rise or ride, not a rise, but he will rise up and down, or she. And so that way you're trying to see if you can not do chest breathing, but do some belly breathing. I also think of it like jellyfish breathing, because to me, it's not chest versus belly, it's more 3 dimensions. And so if you imagine that your diaphragm is attached all the way around here, I kind of think of it like the jellyfish, the ribs in all dimensions go out as you inhale, and then as you exhale, and it collapses. And so I have them sometimes raise their arms and lower, thinking of jellyfish breathing as they're inhaling and exhaling. Harder foods. There's a Mayo Munchie. So if you can get them to eat harder foods, funny story is that I came home and I was like, guys, we got to eat harder foods like beef jerky. And my kids were like, yeah, Mom, could you ever eat beef jerky? And I said, well, I know, but I could. And they laughed. But then I came home and I saw beef jerky on the counter. I said, oh my gosh, Daddy, listen, he bought some beef jerky. And I took a bite, popped it in my mouth, and my kids were like, are you sure that wasn't for the dog? And then I realized that, yeah. Then I realized that, oh yeah, it says human grade. And the fact that it said human grade didn't even make me taste pause. So it did taste bad, but I couldn't chew it. It was a little bit too chewy even for me, but that's pretty funny. So this is a Mayo Munchie. You can get it as a consumer even. You don't have to order it through anyone special. You can go right to their website, but essentially it comes in smaller sizes too. We have preference in chew. I know sometimes kids love to chew, and so that can be an excellent tool. Yeah, so as a parent, I loved those really convenient pouches where they just suck it, but that's not great from a myofunctional perspective. So some other things that you can do are to establish good tongue posture. So for depending on the age, so tongue up is essentially the good tongue posture, but sometimes people don't even have a clue what that means. And so you can take your tongue and put it right on the bump behind your top teeth. There's a little bump right there, the incisive papilla. And if we take the tip of the tongue and draw 20 traces back. For some people, it's super tickly. And usually if it is ticklish, that means that that's how the nerves interpret it, because it usually has never been up there. And so it kind of raises awareness to have that tongue up. You can also do tongue circles right in between the lips and the teeth, and 10 times each direction. Usually that one really makes people realize how strong that muscle is, because if you do 10, a lot of times you start, for me, where I first felt it was really far back here. And so it's wild that doing this caused such an ache back here, doing it that many times. Tongue cluck, the difference between a tongue click and a tongue cluck to me is that click, you can kind of use the front of the tongue, but for a cluck, we really want that back of the tongue to be all the way up in the roof of the mouth. So the whole tongue being all the way up here, so that when you suction it, you see that crazy picture of me on your right, where the tongue, you can see the line and the caves. So that's what we're aiming for versus just having it up. Because if you put your tongue tip up there like this, and you try to breathe through your mouth, that's super simple. But if you suction it up, usually you can't breathe through your mouth and it forces you to breathe through your nose. So having the correct tongue posture actually promotes nasal breathing. So, I love tools. I love things that help. So I am a huge fan of myotape. I don't recommend it for kiddos that are under the age of 4, someone that can't remove it for themselves, and you don't necessarily have to sleep in it, but this is essentially what it looks like. This is kid size, but I've been known to wear kid size before. And what I love about myotape for adults or children, it comes in 3 sizes, is that you can basically take it and you can stretch it around. It's essentially just kinesiology tape. And so it goes around your lips instead of across. So there is nothing to prevent you. And again, this is kid size, so it's going to look crazy. But it goes right around the edges. So you can still talk and you can still open. There's nothing to prevent anyone from opening in their mouth and being able to breathe through their mouth while sleeping, while during the day. So sometimes this is a great tool if they're watching TV, just to get them to close their mouth and change the habit, because a lot of times it's just become so unconscious these days. X-Clear, I love. I even have it in the front of my purse. And it's like, I don't have to take it out, but there it's proof that it's literally right here for me. Everyone in my family has their own, but mine is here. So X-Clear nasal spray, I think, is great because it helps to, as dentists, we love xylitol because it's a natural sugar that helps to fight the cavities that, or the bacteria that causes cavities. But in this way, it helps to fight the virus that causes flu and COVID. It helps to act like a saline, but it acts longer. It's natural, and so you can use it multiple times a day. It's very safe. Some kids don't like the fact that it has a grapefruit extract in it, so it has an interesting taste. I don't know if you've used it, but usually I just tell them to drink a glass of water. Buteco Clinic has a free app on it. It has some stuff for kids on there too, so that's a great resource for parents. That Hoverman Sphere. That's what, oh, that's what this one is right here. But this is actually one of those, goes over mouth taping and how to do it. I have a YouTube channel. I can share that with you. You can share it with people. And then one of them is the link to buy myotape, but you can also go on my website, Sleep Wellness Wilmington. There's resources there. I think there's a Better Breathe Better 5, maybe saves you 5% or something if you use the code. And there's more. So let's see what I got. So there are lots of resources. So in the website here, there's a whole part on patient resources. It has videos for kids and videos for adults. It has recommended products, why I love them, what books I love. It has the ability to schedule a discovery call with me, 20 minutes, complimentary, so we can go over what's going on with your child in particular, or even you, and just so much more. I try to make things accessible. And one of the things that I established also is IE Wellness for Kids. So specifically creating that for you guys here, and it would be coming up in March. Usually the fee is $470, but it will be $247. The cool thing about this month is there's actually 5 Saturdays in the month. So it's 5 virtual visits. That would be group sessions. It also has access to videos within there that go over the exercises, tell you what's going on, some other kind of canned resources at your fingertips too. There is a chat feature in there so you can get support from other people as well as ask me questions. So that is an option, and that QR code can take you to register to that. And then there's some resources too. So I'm certainly a resource, and I do myofunctional therapy. I do breath retraining. I do expansion. But there are other resources as well. And I do work with medical insurances. So I have a medical biller that helps me to figure that out. You get a verification of benefits as part of the initial consultation. So that's an option. There's also speech waves. So they work with insurances as well. There's some information here. Elise Shoki is virtual, completely virtual. She has a resource there that you're welcome to investigate. I just got connected with MyoCoast Therapy. So she is a dental hygienist who has done quite a bit of training as a myofunctional therapist. And so you can look into that as a resource as well. And I think that that is it. So does anybody have any questions for me? You can either unmute yourself if you want, or if you guys had any questions for me, anything. If not, I just might say hi and play and head back to Wilmington. And,
Yeah, so it's still recording.
I can stop recording here. I'm going to stop recording, but I won't turn it off. So if you want to chime in, it'll just take me a minute because I can't seem to find. Okay.